welcome back to the Morning Blend. All right, most people, they worry about their cars if they've been in a fender bender, but they aren't really thinking about themselves. That could be a terrible mistake, though, as the signs and symptoms of injury aren't always obvious right at the beginning. Here to explain and give us some insight is Dr. Devin Luzotti. He's one of the head honcho at Spinal Care of Nevada. How are you, buddy? It's great having you.
Great to be here. Thanks for having me.
So there's a lot of types of chiropractors out there. I think people really appreciate you have this more gentle approach to chiropractic.
Sure.
Let's talk about it.
We take care of medical doctors, a lot of nurses. One of the reasons they refer to our office is because we never twist the neck. There's just more gentle methods.
Yeah.
And that's the first rule in any type of medicine is do no harm. So if you've been in a trauma or an accident or you're already in pain, gentle can be a lot better.
Absolutely. I think when everybody hears chiropractic, they hear immediately that, but it doesn't have to be that way.
Correct.
So how did you end up using these techniques?
Well, I got in a bad car accident. I got smashed, put in a ditch. My car was totaled.
No.
In order to get up in the morning, I used to have to reach behind my head and lift myself up, numbness tingling into my hands. I thought my chiropractic career was done, and I found a guy that did the gentle methods. So I'm extremely sympathetic to anybody that gets in any type of fall, big car accident. I know what it's like, and I know how to treat those.
Absolutely. I'm assuming car accidents make up at least a small part of your practice.
Well, in some way, shape, or form, because it's always in someone's history. You know, you sit down, and obviously if you get in a car accident, you want to get into office right away. It leaves less time for symptoms to settle in. But I can't tell you the number of times I've sit down with somebody who's had a bad disc in their neck, pinched nerve in their back. Well, where do you think it came from? I don't know. Did you ever get in a car accident? Well, I did have that T-bone or that rear end or that side swipe that was years and years ago. Yeah. And what studies show is that in almost 50% of the cases, if you don't get the proper treatment, you got pain the rest of your life. You want to be on the right side of that 50%. So our treatments, chiropractic treatments done well, in over 90% of the cases, can help long-term whiplash symptoms. So yeah, it's better to get in sooner, but even if you have an old injury or car accident, get in and get the care so it doesn't become something you wake up to every day.
Absolutely. I mean, we're talking about the symptoms from car accidents, the whiplash that can be a cause for that, but concussions as well. That's a hot topic nowadays.
It's a hot topic because we're learning more about them and how to diagnose them.
Yeah, exactly.
And not just from whiplash accidents, from sports. One of the growing sports is gymnastics, dance, cheerleading, concussions, and those aren't just female sports, but concussions in women are growing because we're learning more about them, but especially after a whiplash accident, your head snaps back, your head snaps forward. The safest thing to do if you know an accident is coming is actually to stiffen up, look straight ahead, slide down in your seat, because that gives you better headrest support, just if you happen to see it coming.
See, I had that happen once where I see in my rearview mirror that there's somebody that's not braking.
That's right.
And you just hold on for dear life.
That's what you do. You look straight ahead. That protects you the most. In fact, one of the things that we do during our workup when someone is in a car accident is we look at head position, where you're looking up at the rearview mirror talking to the passenger. That increases injury. We take a very special set of x-rays in the case of whiplash. It's called a motion study set of x-rays. Unfortunately, most offices don't take this. I don't know why they don't take them, but it helps us locate the soft tissue injuries in your neck. And helps you get the care that you need.
Absolutely. I know a lot of people, they get in these accidents, they might not feel anything right away, and people are told to go to the hospital or get checked out right away, and they don't want to do it because they don't want to be a complainer. They shouldn't be avoiding this.
Well, listen, the first thing to do to get in an accident is be safe. Safety first. Get off to the side of the road. Don't worry about determining who's at fault. Take pictures of the scene, take pictures of your car, and then call our office right away. I'll get on the phone with you. If I think you need to get to a hospital, we'll get you there. But the sooner you get the care, again, the less time it sets into your body, and the better you're going to recover.
What about contacting an attorney? When should somebody know, or how should somebody know when it's time to do it?
Listen, I'm not a sue-happy guy. My wife, Erin, is an attorney. She's in gaming law.
Oh, okay.
But, here's my feeling. I think if you find an attorney that puts people first, you're probably going to get a better settlement in an accident case. And they're going to recognize the things that we do during our course of care, get you better help, and also help them settle your case. We're going to do a very thorough 2-day workup, whether your accident was old or whether it was new. The 2-day workup, thorough exam, complete set of x-rays, possibly motion study films if we need them. That lets us know if we can help. And then we're real up front. If you weren't in an accident but you've had an old injury that's creeping up on you, causing neck pain, bad disc, pinched nerve, normally we charge $180 for our workup. What we do for this show is the first 20 callers, again, first 20 callers only, we're going to do that full day workup for $37.
Fantastic. That's awesome. I know there are people out there that may have found themselves in an accident many years ago or just recently.
That's right.
Really, before you're even talking to the insurance company and saying, I feel fine,
Yeah.
you should be going to a doctor first.
Call your local neighborhood chiropractor.
This happens. I think the people, they think kind of like, they think sledgehammer versus, tiny little butter knife.
Right.
When it comes to getting things done, they think sledgehammer, you have to have the cracking to feel better. Not the case.
Occasionally we do traditional chiropractic, but again, we've just found, especially if you're already in pain, like I was when I got hit in an accident, what you want is a more gentle method to first get the swelling down so you can wake up in the morning and not reach for that bottle of pills.
Absolutely.
Reach for your coffee.
Right, that's a lot better. And then watch the morning blood. And then, by the way, there's an example of a healthy neck versus a neck with whiplash.
And here's what can happen to you after any type of whiplash. Car accident, sports injury, fall, is the normal neck that should be facing forward curves back the other direction.
Wow.
That's why people have pain their entire life. So with our methods, number one, gentle. Number two, get your relief. But number three, we want to help the patient so that for the rest of your life you're feeling good and not having to think about an accident, which can cause anxiety. It can cause other problems in your body, such as dizziness, imbalance, problems with vision, sensitivity to light. It also affects you emotionally. It can cause you to be extra moody, even more so than you are. I mean, not you, but just in generally speaking. It can cause problems with your health from sleep perspective. Sometimes you have to sleep a lot more after an accident. Sometimes you can't sleep at all.
Absolutely. Well, this is great help. And Dr. Devens, great having you as always.
Great to be here.
Thank
Thanks,
you, buddy. Hey, great special offer for the first 20 callers. It's a 2-day workup. It includes a discounted fee of only $37 for consult, exam, and x-rays, not valid for Medicare-aged patients due to federal guidelines. That's normally, by the way, a $180 value. Pretty awesome deal. For more information, call the number or visit the website. Locations include Summerlin and Henderson. And JJ, over to you.